Welcome to Sakshi TV and welcome to the show Ask Your Doctor. I'm your host Madhuri Gattupalli and today I have with me our esteemed guest Dr. Pradip Shah. He is a board certified doctor of infectious diseases. Dr. Pradip Shah is also a vice chairman in JFK University Hospital. He is the president of NJ State API, American Association of Physicians. Welcome, sir.
Thank you.
Could you please start introducing yourself and your background?
Yes. Hello, everybody. My name is Dr. Pradip Shah. I'm the infectious disease practicing in Edison, New Jersey, USA, for infectious disease for almost 28 years. I practice at the JFK University Medical Center, which is also called Hackensack Meridian JFK University Medical Center. And luckily, I'm lucky that my daughter, who joined with me as an infectious disease 5 years ago, she practiced with me. Her name is Dr. Pooja Shah, and my name is Dr. Pradip Shah.
How did you grow interest in this expertise?
Well, infectious disease is a field where you involve from the top of the body to the bottom of the body, and every organs are involved. While cardiology always deals with only heart disease, pulmonary deals with the lung disease, while infectious disease involves every organ of the body, every parts of the body. So while treating the patient, we always look at a whole body, not just one organ, and that's how I became interested. And also, infectious disease keep changing every minute. Given that, just to give you a recent scenario, we used to have a Ebola virus, before that SARS virus, then we have a latest is the COVID-19, which is still going on, and also in India they were telling these black virus, black fungus and the white fungus. All those are the disease which is infectious disease, and it's fascinating to know organism which has only one cell. We have a billion cell in our body, but the organism only has one cell, and they can damage to the body so much,
So about this disease, what can one expect when they first visit?
Well, infectious disease has a many part of it. One is when they come to symptoms, they usually go to the primary doctor. When they cannot identify or they cannot do, they refer to us as infectious disease. Just to give you example of, there is called mother-baby syndrome or father-baby syndrome. I'm not sure you know, but what happens in this, a father who never had a CMV, which is a cytomegalovirus infection, and the baby always carries this virus, and when the father get involved and they get, first time when they are involved, they get 4 to 6 weeks of fever, and nobody can figure it out, and fever is always worry for any person who get fever more than 3 days, they start worry. Obviously, some people get worry very first day. So these are the disease which we deal with that, and we have to nail it down to see the diagnosis and then treat the patient.
Now, you have said black fungus, white fungus. Now, let's talk about COVID. Everybody knows what happens when they are sick, but not a lot of people know what happens to the people after that.
Okay, the COVID. Let's start with the COVID. As you all know, that COVID started in 2019, November, maybe October. But it has gone. First of all, COVID is the virus. Now, coronavirus has been there for a while, but this one is given the name COVID-19 SAR because it's a little different virus than the coronavirus, but it is coronavirus. Coronavirus is the virus which causes your normal cold, cough, all that. But it has been we call it is the change there. They become more virulent. What that mean by virulence means they invade your organ and damage the body, parts of the body. The coronavirus has a more tendency to cause the damage to the lungs where you oxygen, so you don't get enough oxygen in the body. Bear in mind that it does not only involve lungs, it can involve your heart, it can involve your kidney, it can involve your brain. And what it does is it causes the inflammation of the body in the organ. So when you have inflammation, and if your, let's say the heart, if you have a heart, that artery is clogged, and if you get inflammation on top of that, it's blocked completely and you get a heart attack. Similarly, the brain, your brain arteries are clogged, and if it is cause inflammation more, it completely overloads, so you get a stroke. Kidney also can shut down, but the most important, they cause the damage to your lungs, where oxygen goes into your blood, and that's where it damages and oxygen doesn't go. Now, most of the people in COVID infection, they recover, means no sequela or they don't have any residual damage. But some people carry on the damage because they cannot get enough oxygen. So they get what is called the long hauler or the post-COVID syndrome, where they have a variety of symptoms. Main symptoms are fatigue, short of breath, tiredness, cannot work, cannot focus because they don't have enough oxygen in the body. But there's no treatment as such, but recently there is an article came out and we had studied. There is a medication for diabetes called the metformin. And metformin does effect if you provided you have taken the early, though this is very early finding, they are still working on that. There is another medication which was thought to be better at when the COVID-19 was infection was ivermectin. Right now, ivermectin has no place in the COVID-19. It has been proven, but they are looking into see that it can help in the post-COVID syndrome people.
That's really nice, doctor. I know a lot of South Asians have diabetes and they use metformin, so that's really good information.
Yes, I have seen the diabetic people who are taking metformin. They do have a COVID, but they don't go into the post-COVID syndrome, most of them. So that is a maybe plus point, but we have to still do a lot of work on that to see really. This is just most recently came out, you know.
Oh, that's nice. So now we hear fungus, viral. So what is the difference between antifungal and antiviral?
Okay, first of all, we have to know fungus is an organism which are like filamental type, and the virus are the cellular type. But it can be either way. Fungus can be there. The virus has a propensity. First of all, we have a very limited medication for viral. There are certain medication can be treated with virus, but we don't have a much medication. Or fungal, there are a lot of antifungal medication which can be given. Now, the most common, which is in the COVID area, was the black fungus, which is the mucormycosis, it's called, which is common in the diabetes people also, and mostly involve the nasal area, and that's where you get this. That is called black fungus. And the white fungus also is there, but there are different types of white fungus is there. But black fungus is more, it's called mucormycosis. And that is, and there is a treatment available for that too.
Stomach infections are very common these days. Can you tell me why is that?
Okay, the stomach infection, there are a lot of, mostly it is viral and bacterial. Now, the one most dangerous is the cholera virus. You know, we have known it infect the stomach and people get lot of diarrhea. They put out 40 to 50 liters of the stool in a day. You know, that is a virus, and that is most dangerous, and it's very contagious in the sense that if a patient comes in contact with the patient, they can get it, and there's no treatment for that. There is a medication came out, but we don't know. There is a vaccine just recently came out which can prevent the cholera from you. And the other part of that is there is called norovirus, which is called the people goes for the cruise. It's very common in the cruise because when there is a crowded area, that's when norovirus is very contagious. You get nausea, vomiting, diarrhea, and people get very sick. And so these are the norovirus. And then we have a cholera virus. Then we have a bacterial. Bacteria is the one which are typhoid is the one, Shigella. All those viruses are very common when you eat some food. E. coli is also very common where you eat a hamburger and all which is not cooked properly and you get E. coli. So these are all the, particularly what we're talking about, we talked about the street food when it's not cooked properly or not refrigerated properly. People have some misconception that any food which is prepared hot means not the spicy, but they prepare in front of you and cook, and that is the very good food actually, that because the bacteria get killed. The problem comes when the food is stored in the refrigerator, they are not stored proper temperature, and they start eating them. Remember, bacteria does not get killed with the storage of the food, Sometimes they stay there and they can upset or whatever you acute gastroenteritis, cholera, norovirus, or gastroenteritis. All those are the bacterial infection and viral infection depending on them. But they are sometimes the main reason people die of the cholera is the dehydration and electrolyte imbalance, sodium, potassium they lose in the stool, and that is what's called. So if you hydrate the patient very well, they are self-limiting disease sometimes. What I mean by self-limiting, they live in the body for about 3 to 4 days, and if you hydrate the patient very well, they don't die, and it goes away the virus,
Brings me to my exact next question is, we South Asians have a different lifestyle of eating, the way we eat foods, and some are vegetarian. So how do we take better care of ourselves to maintain better gut health?
Well, that's a very good question. Vegetarian and non-vegetarian. I personally feel there is no place. I'm a vegetarian. Actually, I'm Jain, so so it doesn't mean that I have to preach for anybody to do, but you have to think about there is no place for the non-vegetarian food, and I will explain you why. I think people have misunderstanding. Bear me, I'm not trying to preach you. You can do whatever is your liberty, but the animal product what you eat has a lot of proven to be carcinogenic. Carcinogenic means it causes the cancer in the body. Number one. Number two, we have enough plant-based food that can be healthy. It could be helpful to you, and it's not that only the wheat and the rice we are talking. We have now newer product came in India. I forgot the name, but that is very good. It has a good protein in that. It's similar to the wheat and rice, And so my point is that's number one. The number one problem is in America is overeating. Anybody you take it, there is an obesity problem. So there is no point in eating and getting too much weight on you, which is the number one enemy of yourself. Number two, the non-vegetarian food. Most of them has fat. Of course, nowadays we have a lean meat also. We have a fish, which is very good. Also, people eat it, which is very healthy, But given that the non-vegetarian food is better, even if you look at the best food is in the Middle Eastern, which is very considered, in that healthy wise. Similar, we have Indian food. Lentil is very good. It's a plant-based food. Also, I believe that plant-based food is the most important we need to eat and do to become healthy. Vegetables are very good. They are antioxidant. They are full of vitamin, magnesium, zinc. You need it in the body. So all of this is very important. Obviously, you can make your choice. I'm not preaching that you should be vegetarian, but overall, it has been shown the vegetarian diet is more healthier than the non-vegetarian diet.
That's really good, Dr. Shah. It breaks the myth. So one more question. When you say infections and all, there are allergies that most of us have in India or in US. So how do you differentiate allergies and infections?
Allergy is what we call it is your body cannot tolerate chemicals in the body. Or in other words, whenever you eat any food, let's say for peanuts. Some people have allergy to peanut. What happens when they eat peanuts? Your body is overreacting. You get what is called overreacting your body. So body try to get rid of that and they overreact. So immune system is overreacting. So that causes all these symptoms. So the best treatment is not to eat. If you know the allergy, you are peanuts, you don't eat the peanuts. While the infection is the disease which is caused by the bug, which goes into your body and damages it, which you don't know. But like in allergy, you can get tested and see if you are allergic to peanuts, or some people strawberry even allergy. Some people have what is called in the food we have commonly used the food also allergy. But they can be tested, and if they avoid, they are fine. They don't get any symptom. But bugs you cannot avoid. Bugs are everywhere, in your house, in your kitchen, in your shower, in your toilet, everywhere bugs are there. But bear in mind that bugs are there, but you have what is called immune system. Immune system is very constantly struggle between the immune system and bug. Whoever wins will get you. So if your immune system is good, and if you are bugs come to you, you may not get disease. While your immune system is good, bugs are there and they will take over and you will get disease. So in order to improve your immune system, one principle is to move your body. Now, I don't mean by move your body means just do lot of exercise, but simply walking, moving your hands, moving your leg, moving your body. It does elevate your immune system, which fights this infection. Even the immune system help to prevent the cancer of the body also. So you should have a good immunity, and that good immunity comes from exercise. Exercise doesn't mean that you have to run on the treadmill or anything. Just move your body. Don't be in the sitting position and not doing. Even if you are watching TV half an hour a day, you can move your hand like this, move anyway, legs, hands, you can move. That is called exercise. That means you are moving your body, and that helps your immune system. Also, good food. Plant-based food is very good in the vegetables. Green vegetables have very good immune to antioxidant, which kills the radicals in the body, chemicals that damages your body. Your body goes to constantly damage to your body, all the chemical, and that has to be taken care of, then repair.
HPV vaccines are being given in India, but not a lot of people know about it.
It is HPV called human papilloma virus. This virus usually causes the cancer of vagina or vulva, and particularly in the woman it is common. So this human papilloma virus is the cancer of the cervix, of the uterus, and it is prevented now. We have a very good vaccine. Usually it is indicated between 14 to 26, but we can give up to 42 years of the age. I mean, age it depends, but mainly it is given 14 to 26 age of the age. You can do sometime 12 years of age. Age is indeterminate up to the 26, and it is given. It's a very good vaccine. What it does, there are many types of HPV virus. The most common, which causes carcinogen, they have given this vaccine. Now, HPV vaccine is not 100% safe in the sense that it does give some side effect. So usually when it is given, the doctor observes the person who get the vaccine for half an hour to make sure. But relatively it is safe, and you should get anywhere between 12 years to 26 years of the age. You should get vaccine. It does prevent cancer of the vulva, which is cervical in the uterus, and it's very common in the people. And I have known my own personals that they have died of this cancer, and it is preventable disease. Obviously, this vaccine came out here, but it can be given, and it is advisable to take it in a proper person who is indicated this vaccine.
So how important is lifestyle change and having extra health supplements needed are they needed really for overall better health?
Yes, it is needed. First of all, lifestyle, which I like to say. As I say that your lifestyle is very important. I know we all are busy and all that, but you need to pay attention to your body. Number one, eat proper food, eat enough calorie, not over. I think in America there is a problem of obesity. Every third child is obese, which is very, very sad in the sense. And nowadays, because we have a computer age and people are just sitting there on the computer, not moving at all, they work from the home, which is good. I'm not telling it's bad, but then you need to balance it out with the exercise in the part of your also, because really the exercise, moving your body, I would not say exercise, move your body, that is very important. To do any sort of muscle action will be helpful to you. So given that nowadays I think the 1/3 force is in the computer and they just sit in front of the computer and sit and they work, so they don't get any really exercise or anything. So they need to do exercise, part of it their other way, which can be done many ways. I don't think you need to have all the instrument in your house. Even the single sports jogging, meaning running on the same spot, is also a good exercise. You can do push-ups, all that. Provided you can do, you have to look at your health also. But the one thing I'll tell you, you do exercise, but don't do over also, in the sense that if you get tired or short of breath, just stop it and take a rest. But it's very important. Now about the supplement. Yes, supplement. What are the supplements? Mainly vitamins, zinc, magnesium, those are there. I would say that one simple vitamin tablet is good enough to take it. You don't have to take mega vitamin, which is high dosage. So the vitamins are B complex and vitamin A, D, E and K. The vitamin A, D and K, if you take more than that, it will damage your liver. For vitamin B complex, they are water soluble. So if you take more than that, it just comes out urine, does not hurt you. But you don't need a mega vitamin. You just need simple one tablet of vitamin, which help. And also calcium and vitamin D is very important. And vitamin C also is very important. And vitamin C you can get in the lime or any French orange juice or anything that you can drink. And because when you cook, vitamin C get destroyed. So you can put it on top of the food after it's prepared, so that vitamin C remains in there. So these are all, but simple. You don't have to take mega vitamin, which can hurt you more than help you, you know. And the other thing is people take protein supplement. Yes, protein supplement is good if you are in the childhood and up to the 18. After 18 years of age, you need only 30 grams of protein in the body per day, which you can get from your regular food. But not to eat too much protein. And there is one more, people I have not everybody, but it's called steroid injection to get the muscular, which is very harmful to you. Please never do the steroid in your body. Steroid required in your body, but it's enough in your body, but you don't need extra steroid in the body, because it suppresses immune system. You can get a lot of trouble, lot of infection, and lot of body injury.
That's an important point. You need 30 grams of protein. That's really good. Because
in adult. Okay.
In adults, yeah, because I've seen a lot of protein powder supplements everywhere that I go. That's a really nice point. So thank you so much, doctor. That's all questions we had today. Thank you so much for coming to our studio and spending wonderful time and sharing a lot of things that I don't know myself and our viewers also don't know about infectious diseases. Thank you.
Thank you very much. I hope I gave you some advice. I know that everybody doesn't follow. It's okay. But think about yourself and do some lifestyle change. It will help you, particularly the computer IT, what is called IT people, it's a good profession, I'm not telling, but they need to do more activity. Even the people in India, the housewives, they usually stay in the house and they don't do much exercise. And so move your body, that's the simple message. No matter where you are, you can do at home, you can do at work, you can do on the gymnasium, but move your body. That's the main part of the message. Thank you.